So let's start with a big question for you today. What happens when a huge multi-billion-dollar system that's designed to help everyone actually has its most critical parts starting to work against each other?
It sounds like a theoretical question, but it's not. It's the inevitable result of high-stakes legislation. It's
Yeah.
all about political trade-offs and complexity. And that friction, you can actually measure it. The data you've provided, it shows it's hurting the very people the system was supposed to protect the most.
Exactly. And that's what we're diving into today. One single colossal piece of legislation, the Comprehensive Affordable Healthcare and Economic Resilience Act of 2022. Though most people just know it by its nickname, the Big Beautiful Bill, or the BBB.
Right. And when it passed, the promise was huge. It was framed as this ambitious plan to reduce costs, improve access, and, curb corporate monopolies.
A truly historic moment of reform, that's how it was sold.
But what we're looking at now, with the documents you have for 2026, it's a much messier story, a more conflicted picture. The reality is that this massive bill, just because of its sheer size and its internal contradictions, is driving this immense administrative complexity. We're seeing new, mandated bureaucratic hurdles, especially in safety nets like Medicaid and the ACA marketplaces, hurdles that are actively making things less stable for the most vulnerable people.
Okay, so let's unpack that. Our mission today isn't just to give a summary of the bill. It's to analyze exactly how this one piece of legislation reshaped everything, how it changed incentives and eligibility rules. We're going to track those specific section numbers, look at their real-world impact, and really reveal who, by 2026, is actually benefiting from the BBB. Maybe it's through those targeted tax cuts we'll get into. And critically, who's getting left behind? Who's struggling to just keep up with this new, faster bureaucratic pace?
What's fascinating here is just the scale of it. I mean, the BBB is so much more than a health bill, despite the name. It's a huge, sweeping government change. It affects taxes, defense, education funding, eligibility systems. It's a reconciliation bill. That means it was designed to pass with limited support, focusing just on budget impacts. And whenever a bill is that large, you're going to get administrative friction. You're going to get unintended consequences. That's the trade-off. And our sources show a clear move toward more state-level scrutiny and new documentation requirements, especially for low-income populations.
So to really understand the healthcare parts, the mandated redeterminations, the eligibility traps, we have to start with the big picture. We have to appreciate that the BBB, or HR1, isn't just a health bill. It's a funding behemoth. It's the engine for everything else.
That context is absolutely vital. This bill is basically an omnibus funding mechanism. It's a complex tapestry. You have military appropriations being traded for tax cuts, and those tax cuts in turn are used to fund the healthcare changes. It's all connected. For instance, the bill allocates billions for defense, a significant chunk, like $1.3 billion for expanding unmanned underwater vehicle production, another $500 million to accelerate hypersonic strike programs, billions more to modernize Army, Navy, and Air Force depots.
And these things have technically nothing to do with affordable health care.
Nothing at all. But they were the political sweeteners. They were the revenue offsets needed to get the entire package through that reconciliation process.
Okay, that makes the connection clear. The need to bundle these huge defense expenditures is why the tax provisions that we're about to talk about are so targeted and, more importantly, so temporary. The revenue had to be balanced out quickly.
Precisely. And while those defense appropriations are long-lasting, the immediate, tangible financial relief for individuals is, well, it's deliberately fleeting. Let's zoom in on those tax changes. They're active from 2025 through 2028. That temporary nature really suggests they were designed as these immediate boosts so voters would feel them right away, maybe before the bureaucratic pain from the healthcare side really started to set in.
First up is the deduction for seniors. That's in Section 7-0103. For people age 65 and older, they can claim an additional $6,000 deduction. Or it's $12,000 for joint filers if both spouses qualify. And that's on top of the standard deduction they already get.
It's a powerful, very direct tax break, but it's also highly targeted. The average American senior, maybe on Social Security or a fixed income, they'll benefit the most, but it phases out. It phases out for taxpayers with a modified adjusted gross income, a MEGI over $75,000 for an individual or $150,000 for joint filers.
And that MGI number is key. It's not just your salary.
No, it's designed to capture your true household earning power. So we're talking about relief aimed squarely at seniors, right at the edge of the middle class. It helps cushion the blow of inflation, rising property taxes, but only for that 4-year window. If you're a high-earning senior, you won't see this benefit.
A temporary shot in the arm, not a permanent structural change.
Exactly.
Okay, then there's a really fascinating one related to work. The deduction for overtime pay. You find this in Section 702002, also active from 2025 to 2028. Here, you can deduct the portion of your overtime pay that's above your regular rate.
This is a direct incentive to work more hours, to pick up those extra shifts. You know, when you get paid time and a half, the bill lets you deduct that extra half portion. So if you're a skilled tradesperson, a nurse, anyone who relies on overtime, this could mean some substantial savings. The max annual deduction is $12,500 for an individual or $25,000 for joint filers.
That is a massive deduction limit, but again, it's targeted.
It is. The benefit phases out for AGI, over $150,000 for individuals, $300,000 for a couple. This really reinforces the bill's focus. It's about rewarding middle-income wage earners for more labor. It signals a legislative priority on labor participation, all within that temporary 4-year sunset.
And finally, a big one for consumer spending. This one seems aimed right at the auto sector. The deduction for car loan interest in Section 70203, same period, 2025 through 2028, you can deduct interest paid on a qualified vehicle loan up to $10,000 a year.
It's a clear consumer stimulus, but the devil's in the details here. It only applies to loans that originate after December 31st, 2024. And it has to be a personal use vehicle where the original use starts with the taxpayer. So it's meant to encourage new car purchases, not refinancing your old loan. And critically, lease payments don't qualify.
And then it's even more targeted on the income side.
Right. This one phases out at an even lower MGI threshold, $100,000 for individuals and $200,000 for joint filers.
So the story here is really about immediate, tangible, but very fleeting financial flexibility. If you're a middle-income American, the years 2025 to 2028 are looking pretty good on your tax return.
Precisely. But while these tax breaks are temporary, the bill also introduced less visible but potentially much longer-lasting financial changes. And those changes point to a real shift in philosophy. I'm talking about the expanded availability of health savings accounts. That's detailed in IRS Notice 2026-05. The BBB greatly expanded who qualifies for an HSA and raised the contribution limits significantly.
For listeners who might not be familiar, an HSA is a tax-advantaged savings account that you pair with a high-deductible health plan. You save pre-tax money, it grows tax-free, and if you spend it on qualified medical expenses, you withdraw it tax-free. People call it the triple tax advantage.
That's right. And by expanding it, by increasing income limits and raising contribution caps, the government is sending a clear signal. It's simultaneously offering these short-term tax cuts while also expanding these long-term, private, market-based savings vehicles. The philosophy here is a move away from relying on broad public programs like Medicaid and toward encouraging individuals to manage their own future healthcare costs. It's a dual approach defined by complexity and a real reliance on the market.
And that sets the stage perfectly for where the bill's internal conflict really comes to a head. We're moving now to the core of the healthcare struggle, Medicaid, the program that provides essential coverage for 1 in 5 Americans. And this is where that tension between expansion and efficiency hits the hardest. The documents show the biggest failure point is what's called Medicaid churn, this destructive cycle where people lose and then regain their coverage over and over again.
And this isn't just about tedious paperwork, it's a systemic issue. The sources you provided cite a really sobering statistic. 1 in 10 enrollees lose and regain their coverage within just 12 months.
1 in 10? Why?
Because the core Medicaid population includes millions of working people, people in hourly jobs, the gig economy. Their eligibility fluctuates constantly because of tiny, temporary changes in income. A month with a lot of overtime, a small raise, even a one-time bonus can push them just over that eligibility line.
And when their eligibility fluctuates like that, what are the human costs of this churn?
Oh, they're profound and costly. When someone loses coverage, even for just a couple of months, they forego preventative care. They stop refilling prescriptions for chronic illnesses like insulin for diabetes or essential mental health meds. This disruption is directly linked to higher rates of hospitalization and ER visits later on. It creates immense stress. The system ends up paying more later because it refuses to stabilize coverage now.
The irony you mentioned earlier is so rich here because we have clear, very recent evidence that shows there's a simple solution to this.
Yes, the evidence is overwhelming. We just saw it during the pandemic. The temporary federal mandate for continuous eligibility, it significantly reduced churn. The literature you have shows this policy prevented over 300,000 people from becoming uninsured every single month. Researchers estimate that if you just made continuous eligibility permanent, meaning once you qualify, you're enrolled for 12 months no matter what, you'd reduce churn by 30%.
Okay, so that sets up what is probably the most problematic part of the BBB, according to our documents.
Yeah.
Instead of adopting that continuous eligibility model, which the evidence shows works, the BBB institutes the exact opposite for a specific, very key group of enrollees.
And that's where we hit Section 71107. This is a clear case of a political choice overriding data. This section applies specifically to the Medicaid expansion population, so non-disabled, non-elderly adults who qualify based on income up to 138% of the federal poverty level. Starting after December 31st, 2026, states must redetermine eligibility for these individuals once every 6 months.
Wait, 6 months? So that's a legislatively mandated increase in friction. If you're a working adult whose income might just barely fluctuate over that line every few months, the system is now legally required to drop you and force you to re-enroll or deal with documentation hurdles twice a year.
Exactly. The stated reason from the proponents was, to prevent fraud, to ensure only eligible people are covered. But the documented outcome is a systemic increase in churn for the working poor. Imagine a single mother making, say, $19,000 a year. She picks up a holiday job, nets an extra $300 a month for 2 months. Now she has to navigate a massive redetermination process. She might lose her coverage, only to requalify a month later when that job ends. This is friction built right into the structure of the law.
And the BBB didn't just stop there. It didn't just impose new churn requirements. It actively prevented states from using the modern tools that could actually fix this. This is arguably the most cynical part of the bill, Section 71102. It imposes a massive moratorium.
And the length of this moratorium is just shocking. It runs until September 30, 2034. For nearly a decade, states are forbidden from implementing key CMS rules that were published right before the BBB passed in 2024 that were designed specifically to streamline this whole process.
What were those blocked CMS rules supposed to do?
They were designed to promote and mandate the use of automated, data-driven renewals. They're often called ex parte renewals. These are processes where the state uses existing data, like from SNMR or from tax records, to automatically confirm someone's eligibility, so you don't have to make them resubmit documents or go to an office. The literature identified this automation as the single most effective way to ensure continuity of care. It drastically reduces state costs and processing time. But this long-term moratorium, it just stops that progress in its tracks.
So let me get this straight. The government is mandating more frequent scrutiny, that 6-month check, while at the same time forbidding the use of the tools that would make that check seamless and less disruptive. It's hard-coding bureaucratic inefficiency into the system for a decade. The burden falls entirely on the individual.
It's institutionalized complexity. It ensures people fail because of paperwork, not because they don't qualify. And then the BBB adds another layer. Section 79192 requires states to establish Medicaid community engagement requirements. This is basically the reintroduction of work requirements into Medicaid eligibility.
That's a historically very controversial policy area.
It is. The stated intent is to encourage self-sufficiency, but in practice, these requirements are incredibly complex to track and implement. Even if a state gets a temporary exemption until the end of 2028, they still have to report quarterly on their progress toward compliance. It adds yet another layer of administration, requires huge new IT infrastructure for states, and creates another way people can be disenrolled procedurally if their paperwork is late. The focus shifts from health coverage to just compliance tracking.
Beyond increasing the scrutiny, let's talk about the administrative shifts aimed at cutting state costs, because these also seem to transfer financial risk right onto the patient. Section 71111 reduces the mandatory period of retroactive eligibility.
This is a huge, often unseen change that can literally bankrupt a low-income family. Previously, if you applied for Medicaid, the state was generally required to cover your eligible medical expenses for up to 3 months before your application date. This was a critical safety net. For people who had a sudden medical crisis, like an appendectomy, who were eligible but just hadn't filed the paperwork yet.
And how does the BBB change that crucial timeline?
It's drastically reduced. For that expansion population, the working adults, it's reduced to only the month before the application month. For other groups, it's just the 2 months prior. So let's take a practical example. Someone has a bad accident in October. They're hospitalized, they have huge bills. They finally managed to apply for Medicaid in January when they're recovering. Under the old rules, their coverage would stretch back to October. Under Section 71112, they might only get coverage back to December.
Which means the patient is suddenly on the hook for the massive hospital bills from October and November. or the hospital has to just eat that cost. It directly shifts financial risk away from the state and onto individuals and providers.
It certainly does. And while we're talking about integrity measures, we should mention Section 711105. Starting January 1, 2028, it requires states to check the death master file quarterly against their enrolled providers and suppliers. It's a reasonable fraud prevention measure, but it adds another layer to the state's administrative IT lift, which might divert resources from patient-facing services.
We also have to highlight Section 711113. This is probably the most politically charged provision in this whole section. It relates to funding for specific essential community providers.
Right. This section creates a prohibition. It stops federal Medicaid funds from being used to pay a prohibited entity. The goal here is pretty clearly to cut off a specific type of provider from the Medicaid funding stream.
And that definition of prohibited entity is very, very targeted, isn't it?
Extremely targeted. To be a prohibited entity, an organization has to meet 3 specific criteria. First, it must be an essential community provider mainly engaged in family planning and reproductive health. Second, it must provide abortions, with some exceptions for rape, incest, or life endangerment. And third, its total federal and state Medicaid expenditures in the prior year had to be more than $800,000.
So this isn't some blanket rule that affects every small clinic. It's surgically aimed at specific, larger organizations that are heavily reliant on Medicaid dollars and provide reproductive health services.
Exactly, and the consequence is immediate instability in provider networks, especially in states where these larger providers are critical safety nets. They offer everything from contraception and cancer screenings to basic primary care. So even if a patient isn't seeking abortion services, their access to all the other services from that provider is now threatened by this defunding. It's a clear instance of political intent dictating who gets access to the Medicaid infrastructure.
So if we connect this all back, the whole Medicaid section is just defined by this undeniable contradiction. The bill was supposed to improve access through expansion, but then it implemented provisions that mandate new hurdles, limit financial security, and actively stop the use of modern, churn-reducing tech until 2034.
And that tension access versus friction, it just continues, maybe even gets more intense when we shift over to the Affordable Care Act marketplaces and the premium tax credits, the PTCs. The BBB systematically tightens eligibility for this crucial subsidy program, and it focuses primarily on specific categories of lawfully present immigrants.
The premium tax credit is essential. It's what makes private plans affordable for millions of people who earn too much for Medicaid. And what's so fascinating here is how the new definitions in the BVB create these very specific eligibility traps.
They create what policy analysts call a coverage black hole. We look first at Section 71301. Starting in 2027, it limits PTC availability by introducing and strictly defining the term eligible alien. The credit is now only available to those lawfully admitted for permanent residence, Cuban or Haitian entrants, or individuals under compacts of free association.
Why is that specific list so important?
Because it leaves out several other categories of lawfully present immigrants, people with long-term work visas or those with temporary protected status, people who might have previously qualified for subsidies. It adds this critical new layer of scrutiny based on immigration status, and it directly ties health subsidies to strict residency classifications.
So if you're lawfully living here paying taxes, working on a long-term visa, but you haven't gotten your green card yet, you could potentially be shut out from the subsidies you need to afford an ACA plan.
Exactly. And that exclusion is then compounded by the rule in Section 71302, which creates this intersectional problem with Medicaid. The premium tax credit is disallowed entirely for any period when an individual is ineligible for Medicaid because of their alien status. This starts in 2026.
Let's walk through that scenario, because that's where the trap really snaps shut.
Okay, so imagine a recent permanent resident. They're lawfully present, their income is low enough that they should qualify for Medicaid, say they make $15,000 a year, but most non-citizens are subject to a 5-year waiting period before they can access Medicaid, regardless of how low their income is. Before the BBB, they would have been directed to the ACA marketplace, and critically, they would have gotten a premium tax credit to buy a subsidized plan. Now, because their ineligibility for Medicaid is specifically due to alien status, that 5-year waiting period, they're also automatically disallowed from getting the ACA premium tax credit. They're too poor for a subsidized private plan, but they're barred from Medicaid. They fall into a coverage black hole, no public safety net, and no affordable private backup. It's a critical mechanism for shutting off the marketplace for this specific group.
That is a fundamental tightening of the safety net, and it leads right into the new administrative burdens on the exchanges themselves. Section 71303 details what is basically a verification gauntlet, effective for tax years after December 31st, 2027.
This completely changes the function of the exchanges. They go from facilitating enrollment to rigorously policing eligibility on a continuous basis. They now have this massive compliance requirement called the coverage month rule.
Detail that burden for us. What does that mean?
Under the BBB, the exchange has to verify a person's eligibility for enrollment and for advance payments before the coverage month even begins. Previously, a lot of that strict verification happened retrospectively, usually when you filed your taxes. Now, the applicant has to affirm every month their household income, family size, whether they meet that new eligible alien definition, and their existing health coverage.
So this moves from a post-enrollment spot check to a mandatory continuous pre-enrollment verification process. That's a heavy lift for people with fluctuating incomes.
It's an enormous operational change, and if you fail to comply perfectly before the first of the month, you likely lose your coverage for that month. And on top of that, the exchanges have to establish a process for pre-enrollment verification by August 1st for the next plan year.
August 1st. That seems incredibly early.
It is. It means applicants have to proactively verify their projected income and eligibility for the entire following year, months before open enrollment even starts. The administrative lift for both the exchanges and for consumers is just enormous. If your income changes seasonally, trying to project a full year of MGI by August 1st becomes this high-stakes, documentation-heavy forecasting game. It just increases the likelihood of procedural disenrollment because your paperwork isn't perfect or on time.
And if we look at this alongside the Medicaid rules, the 6-month redetermination, the moratorium on automation, what we're seeing is a pattern. The federal government is making it harder and harder for low-income or fluctuating income Americans, both citizens and immigrants, to maintain stable coverage. The flexibility is just gone.
To really grasp the scale of this, we have to remember, again, this is a reconciliation bill. It's restructuring multiple national programs all at once, impacting the entire financial philosophy of the U.S. We've talked about defense, but it also phases out clean energy tax credits. It's funding nuclear security. There's $1 billion appropriated to accelerate construction of National Nuclear Security Administration facilities. It even changes agricultural subsidy programs and extends them to 2031.
It's breathtaking in its scope. But let's focus on one key new structure that fundamentally changes how savings are done for young Americans. The introduction of what are called Trump accounts, detailed in Section 70204. This is a huge shift toward encouraging investment from birth.
Indeed. These are new tax-advantaged savings accounts for children designed to encourage broad-based investment in the stock market. Parent or guardians can set one up for an eligible child, and they're totally distinct from things like 529s or Coverdell ESAs.
What makes them so unique?
The central feature is the federal seed money. The accounts can't be funded before July 4, 2026, a very deliberate start date, and the federal government makes a one-time, non-refundable $1,000 contribution for each eligible child's account. This is direct government investment into a private savings vehicle.
That immediately gets millions of kids invested in the market, even if their parents can't afford an initial contribution. What are the limits on private contributions?
Individuals can contribute up to $5,000 a year, and there's a powerful incentive for corporations to get involved. Employers can contribute up to $2,500 a year to an employee's dependents account, and that contribution is not considered taxable income for the employee. It's a massive tax-free incentive structure aimed at building generational wealth outside of traditional public systems.
And the money isn't just sitting in a savings account. It has a specific, mandated investment strategy.
Correct. The funds must be invested in certain mutual funds or ETFs that track a U.S. stock index, like the S&P 500. So this legislatively requires that this new wealth stream flows directly into the domestic equity market. Withdrawals are generally restricted until the child turns 18, and after that, it functions a lot like a traditional IRA.
That's a monumental philosophical shift. It's all about self-sufficiency, market participation, private investment for the future. Moving away from reliance on public safety nets, which we just saw are being tightened at the same time.
That contrast leads us right to the changes in debt management, specifically federal student loans. Here, the BDB represents a clear move away from income-based flexibility for borrowers.
These shifts, they're in Sections 82,001 and 80,002. They fundamentally alter the safety nets for navigating higher education debt. The bill actually repeals the authority to offer income-contingent repayment plans, or ICR plans.
And ICR plans were so critical, they allowed payments to be tied directly to a borrower's income and family size. It gave necessary flexibility to graduates in lower-paying fields or who were experiencing unemployment. For any new federal direct consolidation loans made on or after July 1, 2026, they have to be repaid under more rigid standard repayment plans. It removes a crucial mechanism for protecting borrowers during periods of low earnings.
And that rigidity goes beyond just the repayment structure. It extends to the safety valves for economic distress.
That's right. Borrowers taking out new loans on or after July 1, 2027 will no longer be eligible for unemployment or economic hardship deferments. These deferments were vital. They let a borrower temporarily pause payments without going into default if they lost a job or had a financial crisis. Eliminating them pushes the entire risk of an economic downturn onto the borrower's immediate ability to pay. There's no grace period for job loss anymore.
So while the BBB is giving tax cuts and building investment vehicles for the next generation through Trump accounts, it's simultaneously taking away the most flexible repayment and relief options for the current generation burdened by student debt. It's a generational transfer of risk.
Absolutely. And this connects right back to that theme of prioritizing individual self-sufficiency through private means over public safety net flexibility. And we see this tension mirrored in a new revenue stream established in Section 70604, the remittance tax.
This is a 1% excise tax imposed on remittance transfers. So money transfers typically sent abroad by people supporting family in other countries.
And the tax applies specifically when the sender pays using physical instruments. Cash, a money order, a cashier's check. It starts January 1st, 2026. This tax is explicitly designed to exclude people who use modern regulated banking systems. It does not apply if the funds are withdrawn from a regulated bank account or funded with a U.S.-issued debit or credit card.
So who is using cash and money orders to send funds?
You're talking about the unbanked and the underbanked. Often lower-income individuals, recent immigrants, people without official documentation. They rely on cash transfers because they might lack the ID for a bank account, or distrust the banking system, or just can't afford the fees. If a construction worker sends $500 home every month using a money order, that 1% tax adds up. It penalizes them just for being reliant on cash.
So this 1% tax is effectively a de facto tax on the unbanked. It raises revenue based on the transaction methods of those who are already at the lowest economic margins.
It's revenue generation that disproportionately impacts the least financially secure segment of the population.
Okay, so let's synthesize all of this. We've covered everything from temporary tax relief and defense spending to a remittance tax, student loans, and those critical Medicaid checks. So what does this all mean for you, the listener, standing here in 2026?
It means that the big, beautiful bill represents this monumental effort at legislative reconciliation. It's trying to achieve massive reform by pulling all these different policy levers at once. But that core tension is still there. The bill was sold on expanding access, yet it implemented a series of provisions that collectively create substantial new administrative burden and eligibility risks for vulnerable populations. The political need to pass a bill this big require trade-offs that, at the end of the day, hurt the end user.
Let's just review that juxtaposition one more time because it really defines the whole philosophy here. Many Americans got temporary, targeted tax relief through 2028, those senior overtime and car interest deductions, and the ability to seed future wealth through Trump accounts. Those are the carrots. But the mechanisms for stable public safety nets are being systematically eroded or made more fragile.
The tightening of the public health care safety net is just undeniable, and the legislative sections are the proof. We saw the mandate for 6-month redetermination for the Medicaid expansion population in Section 7107, a policy that actively promotes churn against all the evidence. We saw the moratorium on streamlining tech until 2034 in Section 71102, forcing people to deal with outdated paperwork systems for a decade. And we saw the rigorous new verification requirements for the ACA premium tax credit starting in 2028 in Section 71303, which puts low-income, lawfully present immigrants in that coverage black hole.
And this structural tightening, it goes beyond health. It affects the next generation of borrowers by taking away flexible repayment options and hardship deferments. Just as the new remittance tax extracts revenue from the cash-reliant consumer base, the stability of public health care and financial security now hinges precariously on an individual's ability to perfectly navigate this increased bureaucratic complexity.
Absolutely. The bill is a powerful, I think, cautionary example of how large-scale reform, when it's executed through all these disparate titles, can have systemic effects that undercut the very goals of affordable access. The complexity itself is not an accident. It's the most enduring negative consequence of the whole thing.
The sheer scope of this one piece of legislation is staggering. From tax-free overtime to the future of nuclear security and the structure of student loans, it touches almost every part of federal policy. It's defining the entire economic landscape of the mid-2020s.
And that leads us to our final provocative thought for you to consider. Given the simultaneous rollout of major new individual savings vehicles like Trump accounts and the systematic tightening of its internal safety nets like Medicaid and the ACA, is the overarching federal strategy now prioritizing self-sufficiency and private market-based investment? Is it transferring risk to the individual over guaranteeing flexible public support for basic needs? This tension, this deep reliance on the market versus the retrenchment from the state, that is the central philosophical conflict revealed by the big, beautiful bill that you should explore next. What happens when the government encourages you to save but makes it harder to stay covered? That is the 2026 question.